All right, can everybody hear me? Okay, good. Uh, the Zoom meetings, as David said, that is, you would think I had off, but get back in the groove on it. On the COVID-19 response, I will tell you kind of what we did as a city and where we're at right now, because you know this. Probably our first executive order from the mayor was back February the 26th. It was Executive Order 1, where he put me over the response for the COVID-19 pandemic that hit. And I'm going to tell you the honest truth. If this had been a fire, I would have known exactly what to do. I would have known different tactics. I would have known different strategies. I would have had some insight. But with this animal that came up on us, it was virtually unknown to everybody. We had to depend a lot upon governmental, World Health Organization, governmental organizations, the CDC for guidance. I mean, you know, I'm like anybody else here that there's probably, I can't see everybody that's on the screens, but probably some folks that are more medically inclined than I am, as my level basically stops at EMT. But I knew how to protect myself. I knew how to keep from catching a cold. I knew to wash my hands. I knew not to touch my mouth, my nose, my eyes. But whenever we started on this, I guess I read more and more into this being the lead. And we kind of set up guidelines and what we had to do to protect, first of all, our employees, because that was what the city, you know, if the employees, we can have the best equipment in the world, but if we don't have employees to work, it doesn't do us a bit of good. So with the employees and then with the citizens, and figuring out what we needed to do. And we initiated some actions a lot earlier than the state of Mississippi did from strictly a safety standpoint. And we referred back to guidance again from FEMA, that you started hearing a lot of the words of critical infrastructure. And FEMA had a good guideline to go by, and we sat and read through it and determined, along with FEMA, I guess basically agreed with them, what the city of Tupelo deemed as critical infrastructure. Now, you know, we were catching a lot of heat because, and I understand it, because this was a rare time. It was a tough time. But, you know, to me, I understood when people say, well, my business is critical, you know, I need to be open. And basically we came up with a way that if you could answer these questions that tied you into the critical infrastructure, that we would deem you that, and where that you could be open for business. And as the governor stepped in and started doing the safe at home orders and everything, we basically meshed into his plan and followed along with the governor's executive orders. And that made it a lot easier on us. It took a lot of the guesswork out, a lot of the work out, a lot of trying to determine what isn't critical infrastructure. I've followed the numbers, as I'm sure each of you have, since the day that this started hitting in this area. And for those of y'all that haven't looked, you'll have to excuse me. I've got notes everywhere. There was a report of 251 new cases in the state today. The North Mississippi Medical Center has 23 in the hospital and have had 370 tests positive in that system. And remember, as you've heard, that system is it's not talking about just here in Tupelo. It's talking about throughout the North Mississippi Medical Center system. So, but basically, once we started following the governor's executive orders, you know, we just kind of watch each week and wait and see. And as you know, we started in basically the final stages today, where the governor has opened back up basically basically everything goes back in at 8 o'clock this morning, back open with stipulations and capacity guidelines, and we will be that way till June the 15th and watch the numbers and make sure that we don't see a tremendous spike in the cases. With that being said, you probably noticed last Saturday was the largest number of cases reported in one day since this happened, and I'm sure that is due to the fact of so many being tested now. So the more you have tested, the more chance you're going to have of seeing the numbers increase. But we look at ours here in Tupelo with the state numbers, and then we look at the local numbers with the hospital and determine what our area is doing. And right now we're seeing a stable trend, or basically a flattening of the curve. So I guess at this point you kind of know where we're at and what we're doing. Once it got out of the emergency part of it, or the safer at home part, the mayor created an economic task force of groups of individuals in the city that go from federal assistance, state assistance, and local business people. And I am a part of the critical infrastructure team on that, but I don't have any part in that task force. But that's where we're at right now, just trying to get the federal stimulus money and the state money for businesses here in Tupelo. And I'll be glad to try to answer any questions from that area. But if I can't answer it, at least maybe I can put you on the path to get the answers that you need. So that's basically where we're at right now. So I will open it up to questions if you guys have any.
All participants can unmute yourself if you have a question, so feel free to do that.
Thomas, just to confirm where we are, you said that June 1 to June 15 is a phase, and say exactly where we are today, whether it be a church or a restaurant or a wedding or a funeral. Would you summarize that, please?
Okay, I will basically, well, I'll start with churches first, because that's usually the hot topic that we get questions on. And I will tell you that the governor, the president, nor the mayor of Tupelo ever mandated churches, because basically it's a constitutional right. Now the governor and the mayor, Governor of Mississippi and the mayor of Tupelo, Jason Shelton, they both asked local ministers to kind of hold off on having services. Most of them, I go to Calvary Baptist, and we've not had church since March the 8th in person. Now we've YouTubed and Zoomed meetings and services on Sunday, but with churches, basically what you're looking at, and I don't have anything in writing, because like I said, it was not an executive order that the churches close, but it was at a request or urge from the governor and the mayor not to hold services. But there is a, let me see if I can pull it up while I'm talking here, but there was an article that came out. It was in one of the governor's daily announcements that said that churches could open back up as long as minimum distancing could be followed. And that's where you're at right now on churches. I mean, you're going to see the churches, and some this past week have opened back up. I can give you hours at Calvary. We're going to have our first in-person service next Sunday, June the 7th. I went to the church at the pastor's request. He wanted social distancing guidelines, and I told him that downstairs and upstairs that basically we could hold 125 people, maintaining a 6-foot distance. And he backed it down and limited that number to 100. So we're going to do a service at 9 o'clock, a service at 11 o'clock, and you have to respond to an email the church sent out to make reservations to which service you're going to. So As far as churches, it's maintaining social distancing. That's basically the only guideline, and it's asking people over the age of 65 or vulnerable adults who have underlying health conditions to continue to teleconference or YouTube or live stream to take the services in that way until we get this a little bit more under control. So that's churches. Now, I will read you as far as what the governor put out. This is his latest executive order, and this is the one that runs through 8 o'clock this morning through 8 o'clock June the 15th. I'm going to hit the highlights, and then we can come back and address any particular one if you may have. It states that indoor recreational facilities, they can open back up. Basically 50% maximum capacity is allowed. They have to deep sanitize. You know, these will be bowling alleys, playgrounds, the axe throwing business, places like that. They would have to deep clean, then no more than 50 people in. Signage should have to be posted at the entrances saying no customer with a fever of 100.4 or higher or COVID-19 are allowed in. Any items that are touched have to be sanitized. Group gatherings such as birthday parties and those are 20 people max. The employees also have to be screened before their shift each day. Face coverings have to be provided for all employees who come in contact with customers, and employees provide training on how to limit the spread of COVID-19. Retail businesses should continue to implement reasonable measures to prevent the spread of. That's basically what we've been doing with everything before, 50% of the store capacity. Restaurants and bars continue to follow in-house dining guidelines except in Executive Order 1478 and 1486. That's basically the social distancing of 6 foot or more, skipping the tables, the cleaning. The employees must follow under those same ones, be tested every day, and the screening of the customers who come in. Restaurants and bars are now allowed to have live music performance with customers and musicians maintaining at least 12-foot distance. Salons, barbershops, gyms, tattoo parlors, and other personal care facilities must continue to follow guidelines set in Executive 1480 and 1486. Those are basically where they have to do the deep cleaning. The employees have to be screened. They have to wear masks. Healthcare professionals, they can start back performing elective medical and dental procedures and surgeries approved by the Mississippi State Department of Health. You have to go on their website to see what those approvals are. Such emergency procedures and surgeries should limit the use of disposable PPE and not request PPE from any public source. A patient should be screened for recent illness, travel, fever, or recent exposure to COVID-19. Healthcare professionals and facilities should begin testing all patients prior to procedures or surgeries. No visitors in the healthcare facility except for one spouse or caregiver who lives with the patient. And for the safety of residents, patients, and staff, visits to the hospital and nursing homes remain prohibited. Youth sports, team practices. Before practices can resume, league organizers or coaches must provide a copy of Executive Order 1491 to all players and the parents. Players must be screened by a coach before entering the field of practice. They have to ask the questions of COVID-19. Do you have a fever? Have you traveled in the past 14 days? Players and their parents must report any COVID-19 symptoms to a coach. Players that exhibit symptoms will be sent home immediately. Park personnel, volunteers, and coaches ensure social distance is maintained between players as much as possible. Team games fall into the same thing. No more than 100 people are allowed at the game, including the players, parents, and coaches. Ensure social distancing as much as possible. Signs must be posted at the entrance. Movie theaters, they can reopen, but they must be re-cleaned, disinfected, and sanitized top to bottom. all theaters are expected to make every necessary step to comply with 19 regulations and orders. Signage be posted, show times to be staggered to allow ample time to clean and disinfect between shows. Ticket sales limited to 50% of seating capacity. Social distancing and waiting lines must be followed. High-touch areas sanitized every 2 hours. Hand sanitizer placed at all the entrances and concessions area. And the theaters are encouraged to develop new procedures for concessions to minimize person-to-person contact. Employees fall under the same, must be tested and screened. Libraries and museums, again, they can open, but no more than 50%. They have to be deep cleaned, disinfected, and sanitized. Social distancing, tables rearranged so at least 6 foot between tables, and the employees fall under the same thing. Those are the things that the governor has mentioned in this latest order.
Thomas, do you know if a family wanted to go to a movie theater, do you know if they're requiring distance between family members or people who live together, or can they keep up with that at all?
I think it would just be on the honor system. I know it was stated with churches that families could sit together at church, but you had to have 6 feet social distancing between families. And I'm sure that's how they will word it with movie theaters. But I don't know how. I mean, if you go to church as a family, they're used to seeing you there every Sunday, and that would be pretty easy to police. I don't know how they would police that at a movie theater. So that is a great question, but that's one that probably the theater owners or the managers will have to get some clarity on from the next level of government.
Yeah, because what I was thinking through on that was, when you go online, if you get your tickets online and you have to pick your seats, I wonder if they're going to make you pick seats that are separated, even if you're doing it for more than one person that's with you. It's just something to think through that may be an issue.
Right. And I understand. Like I said, that is a great question. I don't know how they would police that, because if Rob Rice and I wanted to go see a movie together, he could call and order the tickets and say, hey, we're brothers, who's going to dispute that? So I don't know how they would police that other than forcing the distance rule.
Hey, Thomas, it's David. One thing that's been in the paper recently was the Baldwin funeral, and I know in Tupelo they've limited it to 10 people, and it may have changed recently, but it's been 10 people or less. Here in Oxford, where I live, we still have a local ordinance where we have to wear masks, and employees in the business have to wear masks, which protects both the workers and the people coming in, which I think has worked real well. So talk about that funeral and social distancing, because I think that's the key here, is responsible distancing and taking the precautions. I know Cooper's had some issues and some companies have had some, and it sounds like social distancing is really the answer.
Yes, sir. I'm sorry. I can't say who's talking, so you tell me your name and.
No, it was David Sparks.
Okay, David. I'm sorry, my screen's it's kind of set and I don't want to move it. Whenever we as Southern people, or people who live in the South or have moved here, we're expected to go to funerals. And this is a hard thing to do, because when you go to a funeral, I know when I do, my first reaction is to hug somebody's neck. It just seems to make them feel better. But I think a lot of this that we're seeing with the large groups, it's not so much the whether if it's indoors or outdoors, but it's when you make that personal contact without any protection, such as a mask. If there's eating involved, where even if it's like a buffet style, that's where you're going to get the spread of illness. And you got to treat this like it is. It is a virus. It's like the flu. It's like measles, it's like mumps. The unfortunate thing is what if you get it, it can put you in a lot quicker, dire straits than any of the other ones I mentioned, and that's what we're trying to prevent. The flattening of the curve was to keep from overwhelming the healthcare system. Now we've got to really focus on not spreading this virus. You know, in my line of work, the chances of me getting sick are pretty great. And I know that's just part of my job. I mean, the chances of me dying in a house fire are there. That's part of my job. But the one thing that I can control by wearing a mask when I'm out like that, not shaking anybody's hand, not hugging anybody's neck, is God forbid that I give it to someone else. I told Mayor Shelton and the department head back in the end of February, 1st of March, is we don't need to treat this like, how can I keep from getting this disease or this virus? What we need to do is change our mindset to, I have this, how can I keep spreading it? And anytime you have an opportunity of a large group getting together, the chances are just greater of spreading the virus. I like you read in the paper about the funeral at Baldwin, and the funeral home director said, you know, we had the service outside, we limited, it was the get together afterwards that they weren't part of. You know, who's to say here or there? I don't know. You know, there's nothing that pops up with a green aura around your head that says if you're positive, that says if you're symptomatic or asymptomatic. The only thing that we know that works is the social distancing, the isolation when you can, and the protection of such as the face mask. Gloves are okay to wear if you put them on before you go in somewhere and immediately take them off after you've touched something. Now, I don't mean to go in the grocery store and walk through and touch everything with those same gloves on. When you pick something up, as soon as you set it down, me and my level of training in the medical field, those gloves are contaminated at that point. I must throw them away. What I would recommend to do is take your personal hand sanitizer in, and when you pick something up, put it in your bag, just wipe your hands off.
Hey, Thomas, Tom Booth, yeah. Tupelo Community Theater here.
Yes, sir.
Hey, I think I heard you say two different things, and I just want to clarify. Of course, we obviously are interested in getting open again when it's safe to do so. I thought I heard you say one time 50 people and another time say 50% regarding entertainment venues. And that's a little confusing to me because I thought at this point we were limited to 50 people.
Okay. Hold on, let me get my papers back in.
Yeah. And you and I can talk separately sometimes as well. I don't want to hold up too much time here, but you know, we have a big theater. So 50%, if we can do 6 feet separation, is a big difference than 50 people, obviously.
Right. I think, Tom, that you would fall under the same as movie theaters. And basically what it says, ticket sales are limited to 50% of seating capacity and social distancing must be followed. So, you know, spread them out at least 6 foot apart and no more than 50% of what your posted occupant load is.
Thank you for that information.
No problem.
Chief Walker, Randy McCoy here.
Hey, Dr. McCoy.
Hey, one of the things is we tried not to overwhelm our medical system, which I think we've done. And now we're getting to a point where the curve has been flattened. And now it appears that we're trying to just slow the spread of the disease itself. Now, my question is this: what happens if we don't come up with a vaccine? are we going to have to live the rest of our lives like this, or then is the medical community going to say, all right, folks, we just got to go for the herd immunity now. That's the best we can do. So my question is, what happens if, like one of these more recent disease, and for me, recent is, 30, 40 years ago, we don't have a vaccine for, yet it's still here. So what's the outcome of, or the prognostication for that?
Well, Dr. McCoy, I think there's one of three options that this will fall under. Number one being that there will be a vaccine for it, but we know that's probably going to be 12 to 18 months away. Number two is I think there will be testing done, and it will be determined that once you are positive for COVID-19, then hopefully, like measles and mumps, for the most part, the way I always heard and understood was once you had it, then you were good. Now I have heard of people having it, more than one case of measles or more than one case of mumps, but it's very, very low. And unfortunately, if one of those two things doesn't happen, then I think that our new normal is going to look a whole lot like what we're trying to conform to now. But hopefully, I'm very hopeful that won't be the situation, but it may be a long 12 or 18 months until we know that we get a vaccination, or a long period of time until we figure out that if you have tested positive, that you're immune.
I'm just concerned that, I'm over 65 and I have not had it, don't intend to ever get it, but if I keep testing, I'm going to be the only one staying home. I'm the only one that hasn't had it.
I understand, and I mean, I wish I could give you a logical, medically backed answer to your question, but unfortunately, right now I can't. I will say this: there is going to come a time that people will say that, and you guys know this. I'm not giving you any new data here, but people will get tired of being cooped up or isolated, and we've seen that happen time and time again. All you have to do is turn on the TV. But I'm just hope and pray that those days of a vaccination or a understanding of the immunity to it comes sooner than later.
Thomas Rob Rice, either from your perspective or what you hear from heads of state, mayor, governor, and beyond, what are the most significant metrics from your perspective? I think about new cases, hospitalizations, diagnoses. What do you watch?
I read a lot of the CDC. I follow and listen to North Mississippi Medical Center and the Mississippi State Department of Health. And I do those not necessarily in that order. I probably do the Department of Health first, then the North Mississippi Medical Center, then the CDC. The CDC gives you more guidelines of what to do to keep from spreading or contracting the virus. The Department of Health and the hospital kind of tell me what's happening in our state and then in our region. I will say that I am a firm believer that the mask, that the distancing works. I'm not so much on the gloves as I spoke before because they become contaminated so easy, but the sanitizer is great. I think following what we've read and what studies have been made, as you see the temperature coming up more and more, I think we will see the numbers of positive cases go down, even with more increased testing, if it holds true to what they've come up with so far.
Hey, Thomas, this is David Sparks again. Noticed over the weekend one of my classmates was exposed at his work. He works in a business. I don't need to mention it and make that public. I think there's a great hesitation and fear when people are potentially exposed in that waiting period. What do you think the message is to people who are quarantined? Because the odds of, just because you're around it, your odds are you won't have it, but what message would you tell people who do have to be quarantined?
I would tell people that if they have to be quarantined, that, number one, call your healthcare provider, call them and just tell them what happened and follow their advice. And if they advise you to go get tested or tell you that you meet the criteria to be tested, by all means, I would go get tested. I will tell you honestly this, we have been safe here at the fire department, and I have not been tested. I'm kind of holding out for the immunity, if they can tell if you've had the test and you have the antibodies, that's the test that I'm holding out for, because you could have had this and been asymptomatic and never showed a sign. But I would tell the people to follow their healthcare provider's advice, get tested if that's what he advises, and just monitor yourself. Look for the signs: shortness of breath, fever over 100.4, and it's kind of like a waiting game to see if anything happens. But if they feel good, I wouldn't hesitate to go outside, enjoy the sunshine. I think that vitamin C is great, and it would probably be, I know it would be a lot better than sitting in the house and worrying and brooding about if I become positive with this.
Hey, Thomas, Tom Booth again.
Yes.
Is there any local free testing for people where money is a concern?
Tom, there was one out on McCullough at one time, but I don't know if they're still doing any free testing. But if they would go to most any local news media is going to have, or they could go to the State Department of Health, they will have links on their websites that would give them the testing. Most of the things that I have seen that are free, you're either going to have to be referred by a doctor or you're going to have to be showing signs and symptoms.
Thank you.
Mm-hmm.
Chief, this is Jeffrey Mitchell. You partially answered my question a minute ago about the rising temperatures. What I was going to ask is it too early for any statistics to be generated on that, or it's just, I know there was a lot of wishful thinking early on that was going to happen.
Well, right now, I think that we're still a little early. If you go back and look, because I did some pretty extensive research on this, and like, again, if there's somebody here that has a more medical training than an EMT, please don't hesitate to jump in. I will not be offended. I need all the help I can get like everybody else. But somebody made the question, well, who come up with the 100.4 temperature? If you go back and look under CDC or any medical book, 100, each person is different. 98.6 is considered a normal temperature, but because of my metabolism, if my body temperature runs at 99.1, the majority of the time, that's my normal one. So 100, everything below 100.4 is considered a no or low grade fever. Anything over 100.4 is then considered fever, and that's where they come up with that number. So right now, that is the number that they're sticking with on all of the published findings that I can come up with, but I think there will be something that comes out later on that will show temperatures, you know, that people that were truly probably the hospitalized category, fevers ran a lot higher than that.
Any more questions from Thomas Walker, Chief Walker?
I have one more. This is Randy McCoy. Chief Walker, the people, I'm going to say talking heads on television, talk about a second wave. And has anyone defined what the second wave is going to be? How many more positive cases are we going to have in Lee County before Lee County and Tupelo is considered to have a second wave and some more drastic measures may be considered by our leadership?
Well, Dr. McCoy, everything that I have heard pertaining to the second wave is I think they are generating that more toward in the fall when the flu season hits again. They are basing that strictly upon flu-like symptoms. You know, we hit the flu in 1917. That came, the second wave of it was whenever a lot of the servicemen returned from overseas, which that was introducing a lot of people back into our country. I don't know what guidelines there were then, if any. I've not been able to read that. Really, I've not had time to. But I think that the second wave they're talking about here is with flu season that will come on in the fall and early winter, that we know that will not be during or before the vaccination can go through the process that it takes to be tested, proven, and deemed safe. And I think that's what the fear is. So I think that we will pretty much be where we're at right now, or where we were in the last 2 weeks. Whenever it starts getting that time of year again, I think you will see it back off as the warm weather comes in. Now, I could be wrong. That's just Thomas Walker's opinion. Please don't think that was coming from CDC or anything. But I think the second wave that we will see will be whenever the cold and flu season hits again. Hopefully not, but I think that's what they're basing on saying the second wave.
Any more questions for Chief Walker? If not, Thomas, thank you for joining us today. It's been very, very helpful for me, and I'm sure the other participants.
Thank you. It was my honor to be here, and I want to say this before I get off, guys. My phone number is 662-841-6439. That's 841-6439. My email is thomas.walker@tupeloms.gov. thomas.walker@tupeloms.gov. Please don't hesitate to call or email me if you think of something, if you hear something. A lot of times when you call and ask the questions, it gets me into the books and onto the website trying to get answers that gives me vital information. So don't hesitate to call or ask me. Remember, in my line of work, there are no stupid questions. Just sometimes I give stupid answers, but I try not to. But it has honestly been my pleasure to meet with you guys. I've spoke to this group before, and it is kind of odd not to look around the room and see the smiling faces, but I can see you on the screen, and I've enjoyed it. So if you ever need anything, don't hesitate to call me.
Thank you, Thomas. And a word of advice: if you invite Rob Rice to go to the movies, make sure he buys the tickets.
Well, I thought if he would get the tickets, I'd get the popcorn. Thank you, guys.
Thank you. Oh, Kathy, nice mask you got there. Jenny, if you'll, can you tell us what guests we had join us today?
Yes, so during the meeting today, we were happy to have Amaret Spites from the satellite group, and Christy Luce is still on from the satellite group. And Christy has actually been on every meeting, every Monday meeting that we've done. So thank you, Christy.
You're welcome. I enjoy it.
Good. Okay. Let's see. Okay, next week we will have a Zoom meeting again. Next week it'll be June 8th. Speaker will be Keith Carter, who is the Ole Miss Athletic Director, and we will be inviting all North Mississippi Rotary clubs and the Memphis Rotary Club to join us. So hopefully we will have there'll be so many people on there that you won't be able to see all the faces. But anyway, that's what's on the agenda for next week. If there are any other announcements, if not, we will be dismissed with the Rotary motto: "Service above self. When puppets most who serves best."
Thanks, Ron. Thanks, Thomas.
Thank you.
Thank you. Have a good day.
You too.